Hi, I'm Dr. Elias Tam, and today let's talk about aging. Aging starts amazingly since the moment you hit 21, that's your peak, and from then on, it's a downhill all the way. Unfortunately, that's true because that's when our hormones start to drop, and most of us will lose about 1% of our hormones a year. It will start to become more obvious generally in the 30s and 40s, when we start to not just have laxity of the skin but also volume loss in the fat compartment, and by the time we hit our 50s we probably also will have some shrinkage of our scalp, and that makes everything more pronounced. If we talk about treatment, I think we can start with something very simple. I call them skin exercise. You can start with something simple like intense pulse lights or lasers that are non-ablative, and it's quite easy to do. You will go in and out probably within half an hour and you'll be out of the clinic. A lot of people say that, oh no, is it going to be scary, painful, will there be downtime, I don't want any surgery. In fact, surgery is not even in our consideration until you're much older. So I would recommend something non-invasive. So besides the continuing the intense pulse like IPL or lasers, we can do something what I call the focused ultrasound. So what does it do? I'll show you what it does. I'm sure all of us have heard of using ultrasound to scan for our internal organ, just like how we would scan a baby in a pregnant lady. So this is a screen. You can see that there is ultrasound, and this is what it does. We can actually scan my skin, and we can see the dermis, the epidermis, and showing the line where the dermis end and going to the epidermis. This epidermis is the dermis. So you can actually see the entire layer of your skin with this ultrasound. So if you look at the face, we'll want to divide the area. The area that are usually of concern will be over the cheek area here, around the eye, including the forehead, and focused ultrasound has been approved by the FDA for brow lifting. So by tightening the skin over the forehead, you might actually be able to achieve a bit of brow lift without surgery. And beside the cheek, you can actually achieve some result over the neck as well. If you look at the screen, you will be able to see this ultrasound. It's like the scanning of a baby. You can actually see the different layer, and the resolution is really good. You can see that this is the thickness of it, from 1.53 to 4.5 mm. And you can clearly see the thickness of the epidermis. In the first pass, we will target at the junction here at 4.5 mm, and this will help to tighten muscle, which is the muscles, the superficial muscles that support the face, and by targeting this level, we will achieve a tightening of the deep tissue of the face. So while we are treating, we are applying this applicator on it. The ultrasound are being focused into specific depth in the skin. It was at 4.5 millimeter. Now it's at 3 millimeter. What it does is that it will create the focus area of high intensity, triggering a repair and collagen production. And because it's being treated in a linear manner, it will cause contraction in that specific factor or in that specific direction. So in simple terms, what we achieve is that tightening of the skin, improvement of the skin texture, and overall improvement of the contour as well. Because this is ultrasound, it is actually colorblind. It does not is not affected by the skin color. It can be treated on someone with very fair skin as well as someone with very, very dark skin. How about those who go into their 40s and 50s? Sometimes there's a need to try and re-drip the skin. There are alternatives. You might think of those facelifting surgery, but I could actually want to delay that. Why? Because aging is a continual process. It's nothing to stop aging. And if you're going to have a surgery in our 30s or 40s, in 10 years time when we're in the 50s, you have to go for another surgery. That sounds quite not so good, right? Yeah, too many surgery. So I would recommend something non-invasive. So besides the continuing the intense pulse like IPL or lasers, we can do the focused ultrasound.